Well, we know we put a lot of stress on our bodies every day, especially if you're physically active.
But if you're doing things like exercising properly, some of those back and neck pain problems can be avoided.
Today, Dr. Marilyn Gates, a neurosurgeon with the Spectrum Health Medical Group, is here to talk about prevention, treatment, and how they diagnose problems.
Okay, so let's start about prevention, because that's something that we can all hopefully understand here.
Okay.
What are some good ways to prevent the pain?
One of the major things that you can do is just exercise, stay active. Even if you're someone who's very overweight, a lot of people will say, well, I can't exercise. I weigh so much. It's so hard for me to get up. There are exercises that you can do sitting down. Just getting up and walking 5 or 10 feet. If you do that several times a day, you're continuing to use the muscles that you need to use to try to keep things as healthy as possible. In our office, we just measured, we're in a new office, and we just measured how many steps it was around the outside perimeter. And we're going to get pedometers, and we're going to try to get 10,000 steps a day.
Wow.
And forget the elevator, use the stairs.
Use the stairs. It was only 6 floors, we can do it.
Well, it's nice when our doctors are taking it upon themselves to also participate in a very healthy lifestyle.
I think it's important. It's hard for me to tell you that you need to be in better shape if I'm not working at it myself. So
right, absolutely. Yeah. So is it ever kind of too late for someone to think about even starting minimal exercise? Say maybe someone's in their 40s, 50s, or even 60s, and they're sitting back and saying, I was kind of been pretty sedentary. Is it better to do something than just to continue doing nothing?
I think it is. And I think that if you're going to do something that you've not ever really done before, you probably need to see your primary care provider to make sure that you're healthy enough to do that and put some limits on what you should do. But there's always something that you can be doing. You can build muscle up into your 90s.
Wow. So, that's great to hear.
Yeah.
Okay, next, breaking bad habits.
Yes.
I know that's not the easiest thing to do for people.
Nope. It isn't.
Are there different ways that you suggest doing things? Let's say quitting smoking, because that's another
Quitting
thing.
smoking is really tough for people because it's kind of a go-to when you're stressed. It's something that you're very accustomed to. You may be around people who smoke.
You might be addicted.
For surgery, oftentimes what I tell people is that if you need a surgery, if this is something that's elective, being done for pain, I typically will not do it unless you've quit smoking for 8 weeks. Part of that is because I think we're a partnership. I'm being asked to do something that's really quite risky and extraordinary to try to help you to get better. You need to partner with me to do that. And I've really had very little trouble with that because people then have a goal. And that may be where we fall down when we're trying to quit smoking, is we don't have something that's so important that we decide that this is what needs to sort of put us over the edge. Not going to McDonald's quite as often, you know?
or eating any of those other kinds of foods.
But there are salads that you can have, and almost all of these places have nutrition information. So it's not hard once you get used to it. It's just, it's hard to make those decisions at the very beginning. And I struggle with it
is the worst. You know, just saying I'm not going to have sugar for a week. It might be painful at first, but then you really don't miss it when it's gone.
So I try to get people to do things in measurable packets. If you're somebody who has just started to walk outside and you live in an area where there are mailboxes, pick a mailbox and walk to the mailbox. When it gets really good for you, add a mailbox or add a telephone pole or go without sugar for a meal. And then go to 2 meals. Everything is something that you can measure, and you can say, look, I did that. And if I can do it for this one, I can do it for the next one.
I think this is an interesting time of the year. I have kids that are very athletic, and this is the time of the year they're doing all the sports camps and the conditioning and all that stuff. And as you know, Mom, I'm excellent at driving a carpool, not so excellent about making time for exercise. And I think about that downtime. Instead of reading a book or taking a little nap in my car, maybe I could get out and walk myself.
Just a little bit. Get some fresh air. Get out of the car.
Yes, exactly.
It's hot in there.
So, you know, what are some other things that you talk about that you tell patients that come to you? You know, that.
Well, I stress a lot physical activity. All of my patients know that as soon as you have surgery, when you wake up, I want you up. I want you up and walking. I want your muscles to remember what it is that they're supposed to be doing. And so I spend a lot of time on that, and I talk a little bit about healthy nutrition and make some recommendations for them because they're all things that I've struggled with as well. And we just talk about individual things that people may be having a struggle with. Using physical therapy, if you don't want to go to physical physical therapy every day, go long enough to get a good physical health program to do so that you can do it on your own. But remember, this is an everyday activity. You don't have to do an hour's worth of exercise every day, but you should be doing something, something that you can benefit from each day.
So when you talk about treatment options for people, a lot of us hear neurosurgeon, we think right away surgery, but really that's not a starting point for...
Surgery should be your last option. Surgery should be after you've tried everything else, because once you cut skin, you sort of open yourself up to a whole number of risks that you weren't necessarily prepared for.
Okay.
There are things that can happen, surgeries that are done beautifully that just don't work for you. So let's try to do something that is a little bit healthy for you, that maybe keeps you away from having a surgeon have to do something.
Okay. So if people have more questions, they should contact you. We have your information up. You have a brand new office where you are.
Yes,
but
and
on
it's
Michigan
fabulous.
Street. Yeah. Still in the same area, near the hospital.
We're very close to the hospital, and I think it's a really nice place, and we have some fabulous people working in the office, and I think we'd be happy to help anybody that gives us a call.
And you're new to the area, so welcome to West Michigan.
Thank you.
Yeah,
So happy to have
It's
you and
fun.
your talent here.
It is great, and I love your approach. I love the word partnership. Anytime you're talking about any kind of a relationship with your doctor, I love to hear you want to be my partner.
Great. That's how I feel about things.
Fantastic. Thank you.
We'll be right back.
This is 8 West.